Hello, everybody out there in listener land. This is Jill from TSC Talks. Thanks for tuning in to our live stream. We are here with Dr. Uma. Dr. Uma was a guest on the podcast back in November, and we connected, and she thought that it would be a great idea to come on and talk about coronavirus, what's going on in Massachusetts, what's going on, outside of Massachusetts, and what we can do here and now to prepare, to be ready for any future pandemics, and just learn from this whole experience. So Dr. Uma is the founder, CEO of Global Health and Hygiene Solutions, Uplifting Health and Wellness. She's a highly respected physician trained in family medicine, occupational environmental medicine, specialized in heavy metals, a fellow of the American Academy of Family Physicians, a cannabinoid medicine specialist, and medical review officer. Thank you so much for being on.
Thank you, Jill. Thank you for having us. And it is truly a pleasure and an honor to be back here with you and be able to address some of the questions and concerns.
Awesome. All right, well, let's get rolling. So I guess, why don't you tell me a little bit about what's going on with you and how you've been impacted, and just kind of open it up to your thoughts personally.
This is a great, I look at it as an opportunity for people to actually reevaluate a lot of things that we've been doing day to day. And telemedicine is something that I've been very familiar with, going back to more than 20 years. And even the way I trained in family medicine, we were able to take call overnight, and we were very well trained in the electronic medical record system as well. And that's going back over 25 years ago. So this is a good foundation that I've built on. But right now, this is also a tool that healthcare providers can use to get out and reach patients, and vice versa, patients to reach their healthcare providers in a very safe manner, and also have it be covered by their insurance companies. And that's what's very important right now. As a primary care physician, I'm actually answering questions for my patients, doing screening calls for them to address their concerns. If we can avoid somebody having to leave their home to go get a testing done, to be again exposed, and this is the most important message that we're sending out to people, is social distancing.
Right.
We have a virus that we've learned, we've seen what it has done globally, and we are now taking proper actions as to what to do to deter it, in having it become impacted by everybody. And these are the things that we are trying to help educate people about.
Okay. What are you seeing? What are people calling about? What can people do at home to, diminish their fear? And at what point do you think someone should contact a health professional?
So one of the most important things to understand is what to look for, right? Okay. The questions that we're asking is, do you have a cough? Do you have upper respiratory symptoms, i.e. congestion, runny nose? And these are differentiating factors from, is it just a cold? Is it that you have an allergic reaction? Are you having the flu? Or is it just variations? And when do you act upon it? And also, the most important thing that we have to understand is who the individual is. The elderly, the immunocompromised. These are the people that we know from history, any type of viruses are going to impact them more so than somebody that's healthy. So the things that we want to really concentrate on is the people that are ill, to prevent them from getting worse, to maintain their health, so that we can avoid further treatment, i.e. getting them into a hospital, getting them into an emergency situation, trying to keep them managed at home. This is one of the things that we're trying to do. So how do we do that? Understanding, is there a fever? Do you have a thermometer at home? What are the things that you could do if you don't have a thermometer? People will feel themselves. They can even get their heart rate and measure ways to see if their temperature is up. Other tools that we can use. Have they had anybody that they know has had an exposure to it? Have they been tested? Is it confirmed that they have the coronavirus? These are all the questions that we're going through to make sure that we're not missing certain things. and also advising them, wash your hands, cover your cough,
Yep.
don't litter, don't spit, brush your teeth. These are the 5 hygiene things that I had put into place in 2006. And I'll repeat them again. Wash
Please.
your hands, cover your cough, don't litter, don't spit, and brush your teeth. These are all things to keep us hygiene and effective as far as prevention. As
Excellent.
far as our numbers for health, people should be monitoring. If you've got any health issues, know what your blood pressure is. Is that changing? Okay. Is your weight changing? Because this is a concern with cardiac issues. If they are in fluid overload, these are the measurements that they check on them. Is there weight variations? Because this means whether they have to take a medicine or not take a medicine. Okay. What are the things to manage for? What are the things to look for if they're managing their glucose? Are they diabetic? Do they have to make sure that their glucose levels are not high? Is it being managed? If they're on monitors, is their monitors working so that they're able to send information properly to their healthcare providers? Right now, we have a telehealth monitor right now at home, which does a blood pressure monitoring. It does a pulse ox monitoring. It does a weight monitoring. It is able to look at people's activities. So there's things that are already in place. So use these tools if you have them so that they can be your devices of communication. Understanding that what we want is people to know what meds are they taking.
Mm-hmm.
They get their list of medications. Somebody, if the individual themselves does not know, contact their pharmacist. Okay, so that preparedness again.
Okay.
What are meds? Are they all needed to be taken? Are they only taken when you need, if something happens? PRN medications, they call it. Understand that breathing is something very important. And we talk about that. And you just lifted yourself up, posture.
I did.
And yes. And we've taught our patients simple things as 5 times 2 is 10. Okay. And we've talked about the importance of breathing. So breathe in through the nose, count 5 seconds. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000. Hold your breath for 2 seconds and then let it out through the mouth and count 10 seconds as you do that. Let the belly button go in. And if you cough, it's okay. These are simple things that I want people to understand. People don't realize that they're not breathing.
Yeah, and whatever we can do to keep from falling into like panic and obsessively thinking about and reading the news. I think that that's what I see going on a lot. Everybody, you turn on the Facebook or whatever and you're reading this post and like this heightened sense of fear. And, going back to the facts like you just went through, what do we need to look at? What are the actual symptoms that would, encourage us to go see a doctor or a health professional, and personally wanting to stay away from the whole healthcare system right now, unless there was a dire emergency and I needed to go or one of my children did. So, yeah, that's helpful.
Absolutely. And what we want to understand is that how to eat properly. We are in a system right now where people have different kinds of foods. What are they munching on? What are they putting in their body? Where was the sources of their food? Because understanding this brain-gut connection is very, very important. If you're not feeding your gut properly, you can't think, okay? And this is where we talk about hemp. We talk about cannabis use in different formats of how people can just make sure that they're eating a high-protein diet. Again, these are general things. You might need to adjust it if you are on kidney dialysis or if you've got kidney issues. So all of these will be appropriately, can vary depending on individuals and their health issues. But in general, try to lower the carb intake because, again, that elevates your sugar. Okay, so we want people to have good protein. And this is where hemp is a great source of protein. 3 tablespoons, 10 grams of protein and the omega-3s and the omega-6s. People are making sure that they're getting their appropriate amounts of those. Their sources of where they're getting their omega-3s. Making sure that they're hydrating. This has been Dr. Uma's rule number one. Even before we got into the cannabis world, I've always pushed water as a source of, because it is very important. And again, the balance of whatever we do, balance, putting ourselves at ease. Because again, I'm talking about cardiac patients now. Too much fluid overload is bad, okay? But at the same time, if you're not having enough fluid, that's also equally as bad. So making sure that it's balanced appropriately for you, keeping a track, hydrating with a little bit of lemon or lime, a couple drops of apple cider vinegar, add your fruits, different ways, make it fun.
Mm-hmm.
You know, make pictures of it, add your mints, you can add different seasonings, whatever you like, incorporate these things that are going to help you to boost your immune system up as well.
I was just going to say that it seems like it's kind of putting us in a position where we really need to kind of monitor our own, symptoms right now, instead of what in normal circumstances we might call a nurse or call a doctor. So it's kind of like putting us in a place where we're going to be engaging in more personalized medicine, and an opportunity really now.
Absolutely. And this is what we've always promoted, and we're able to do this now for our patients. And at this point, the government officials have made provisions, all the HIPAA, like the provisions of protecting personal information is kind of being lessened, in the sense that we're able to do more communications with the phones. We're able to talk to people without having to have everything be HIPAA, but we are following all of those guidelines as well. All of my staff are HIPAA certified, so they understand when the patient calls the importance of sharing their information with us, and vice versa. We have been able to, depending on the patients, share information with their doctors and their healthcare providers, and vice versa. We want to be here as a resource for them. We want to be here to answer your questions, and all of these calls, again, can be submitted to their individual insurance companies, and hopefully will be reimbursed, because Mass Health is doing it, Medicare is doing it, the insurance companies, and also different states. I'm licensed in Massachusetts, Connecticut, and Washington, and I write the medical marijuana certifications for New Hampshire as well. So we're trying to help as many people through telemedicine to getting them certified and being able to have them access their medicines as much as possible. If there's prescription medications that people need, other than the opioids and Schedule II drugs and so on, I do not write those, but there are doctors that are able to write those, and there have been made arrangements for those drugs also, allowances made for them to get these medications as well. I call cannabis the exit drug. So I want to talk a little bit about that, because people have used it to get off of their pharmaceuticals, their narcotics, their alcohol and nicotine. And now patients that can't get their medicine are now probably reverting back to those other habits, which is alcohol and nicotine, and more of their medications that they might have to be having to use. So please check on these meds. The other people that are healthy, please check on the ones that aren't. I always say one healthy person can help 4 other people. One sick person takes 4 other people. So as long as we can keep ourselves healthy, we can help more people.
Excellent. What is going on in Massachusetts in terms of, just give us as a doctor, a rundown in terms of the cannabis industry and just in general, the restrictions, if you have them at your fingertips.
Absolutely. So, we have talked about social distancing. We've talked about actually limiting everybody's work to being at home. Mm-hmm. We've shut down all our meetings. We're doing them either virtually or through phone calls. We are keeping in close contact with DPH. They are updating us. We have a meeting later today, the Mass Medical Society, with an update coming up from DPH. So we're keeping as many people informed. There are people that are shortage of equipment. They're trying to get them into places. The hospitals are getting prepared in every way. There's also expansions of drive-thrus where they're doing testing that are done. We're being creative, and this is what we need to be. If you are in a position where you can help others, please pick up the phone and check on people. Those are some of the simple things that we can make sure. If you feel comfortable checking on them, please do, because home health aides have been limited. They themselves need care. And, so it's a catch-22 situation. Do you let people into your home knowing that they might have been exposed or don't even know that they have been exposed? So this is where taking the precautions are absolutely valid. But again, put it into a balance that you can handle it. Hand washing, let's talk about that. All of these hand sanitizers people are using, make sure that they don't dry your skin out. So patients that have skin breakdown, wound care, please check on them. Make sure that these wounds are well cared for so that they don't get worse. Okay, prevention again. If you're diabetic, if you've got other diseases, sarcoid, lupus, all of these things that can predispose you to other breakdowns, please check on them. Visually, people that have glasses, please make sure that you've got your prescriptions. Make sure that you can maybe get a spare set of glasses. If you need your contacts, make sure you've got backup, or if you don't, all of these simple things, hearing aids, hearing aid batteries, simple things that they want to have them be checked. Heart monitors can be checked remotely. Check in with the people, know who to call, so that if you do have what is considered as an emergency situation, that those numbers are at your fingertips.
Yep.
And let people know around you what's going on. The beauty of technology is that we do have virtual things. We can have FaceTime. We've got all of these abilities through the internet to communicate with all people all over the world. So checking on people, understand that numbers are numbers, what we're getting out. Understand that we've got an older population. If we're testing more people where we weren't testing more people. So these rates and these numbers, I want to take it with a grain of salt till we get all of the information. Okay, so I don't want people to just panic, but understand that this is not the first virus. This is not the first pandemic. It will not be the last, and we will move on. Use this as an opportunity really to embrace what is around you. Learn as much as you can. Pick up a hobby, learn about something, pick up a book, share a story with your family members. I've been sitting here listening to stories from my relatives and my father, and things that you might have not been able to do. Really use it as an opportunity. Journal some of these things and bring joy. This is about, the 3 words that we use is educate, embrace, and empower. So do that. Really take the time to do that.
Yeah, just a question about the endocannabinoid system and there's been a lot of posts and thoughts out there like cannabis can help with this. There's been some, dangerous claims made in certain places. So what are your thoughts on that?
Okay, so let's talk about the endocannabinoid system first and why this is important, and to understand that if doctors have not learned about the system, that they need to learn about it. Everybody needs to learn about it, because the endocannabinoid system is in your body. It's in everyone's body. It has evolved from a C-square to what we have in humans today. The receptors are throughout our body. There's CB1 that's primarily in the brain, CB2 that's primarily in our immune system. This is why it's important. There's other receptors that we're learning more and more about. We have a spectrum, as I call, of our cannabinoids. Our most intoxicating cannabinoid is THC. Non-intoxicating is CBD, but there's a whole slew of them in between. We talk about how they work with you. So each person can vary, okay? We want to talk about how people are consuming it. Inhalation, ingestion, topically, under the tongue as a tincture. Tinctures can be held under the tongue for periods of time and then swallowed, so you get a double bang for your buck with that. Suppositories, vaginal suppositories, rectal suppositories, methods. Even the belly button can be used. Topicals can be used. Abdominal pain. So understanding what the endocannabinoid system is and how it works, and how cannabis in various forms, topicals, in skin prevention, making sure that your skin does not break down. We know that they've used it for MRSA. So people with skin infections, how can we incorporate this with their topicals? So again, not to worsen things, to prevent things, and also to treat things. We know cannabinoids are an antioxidant and also a neuroprotectant. So how people are incorporating this into their diets, how cannabis users, I would love to do a survey retrospectively and say how many cannabis users did get the symptoms even of this, how many people did test positive, and all of these things cannot be done right now. But these are the food for thought that I want people to think about. You know, are you in a good state of mind? Are you in a good state of how you feel? Make sure, even if you're feeling down, it's okay. It is absolutely appropriate.
Yeah.
Long time ago, I had read fear, future events appearing real. That's all fear is. So we don't know. The uncertainty makes us feel very much in a situation where we feel that things can impact us. But use it as a time to empower yourself, because you are healthy. You're doing all the right things. You're hydrating. You're using your medications appropriately. You're helping other people. And most of all, you're being supportive to your body.
Excellent. Can you tell us a little bit about, you know, in a bigger sense, I know we were talking before, before we went live, about why it's important to learn from what's going on now into the future, and with your incorporating your background a little bit.
Absolutely. So some of the things that I've learned as part of an occupational environmental medicine physician is, like, anytime we look at an exposure, what are the ways that we manage it? You know, if we know that like a hazard is there, in this case, it's the virus, you know, how do we eliminate this? Okay. How do they substitute it, in the sense of, like, this is how if there was a known hazard that we are working with, how would we replace it with something else? But then this is the main things that how we approach it. It's called engineering controls. That's what we are using in a public health manner right now. We are telling people to isolate. Make sure that you are where you are and do not spread, and don't also have the exposure from other people that can possibly been exposed to this virus. We are trying to then also change people's behaviors, right? We are telling people you got to work from home. So part of the engineering piece is making people aware. So the awareness, changing people's behavior, and actually the last piece is wearing the personal protective equipment. That's the last, if we look at on the totem pole of how we implement things. So now we're having people wear personal protective equipment so that we can make sure that they are not spreading it, and also we are not getting exposed to it. But absolutely, I'm telling people, get your immune system up, make sure your skin is not broken down. Even things like keeping simple lubricants like coconut oil, olive oil, these simple things that people can use to make sure that their skins are not broken down, okay? Really looking at what you have at home, and looking at what you're putting into your body or what you're not putting into your body, making sure you get your extra vitamin C's. If you need your vitamin D's, vitamin D as in David, B's and D's, making sure you get enough sunlight, okay? Make sure you open up the drapes, get some fresh air into your homes, okay? Let the air circulate.
Excellent. Beautiful. I think that, I guess my next question would be, oh my goodness, I'm blanking out. Yeah, going forward, how do you think this is going to change us as a country, as a, you know, community? What are your thoughts on that?
I think we're going to get more prepared.
Okay.
You know, I really
Okay.
feel that this is an opportunity to adapt, and we are going to get through this. I have no doubt about this. And, you know, when I worked at the Hanford site, we would do trial mock runs of if there was a leak, what we would do. And maybe we need to do those things more often in our homes, making sure that you have, you know, what are the things that we need to do ahead of time? What are the medications that we need? Who are the people that need to be contacted? Do we have a support system? And would we make sure that maybe we would start to limit things to 2 items per person earlier than later?
Mm-hmm.
What are the items that we should make sure? Should we have kits that can be prepared right now? When I worked for Kimberly Clark, I remember in 2003, 2004, we had this impact us very close. We had workers that made all the purple gloves.
Really?
The avian flu. I went to Thailand with 100 doses of Tamiflu. And we were like, what the frig are we going to do with 100 doses? We've got 7,000 people, you know, and 4,000
Right.
of them live. And what we did is educate them. We made sure that they were hydrated. These were the things. And we didn't use even 1 dose of Tamiflu, you know. So this is where
Really?
education is so, so important, and getting everybody on board to understand why we're doing this. We're not trying to just keep people apart, but
Right.
this is done to protect people and not to have this progress any further. That's one of the main things that we're trying to do. Learn from other countries what's going on, where people did go out and contaminate other people. And, you know, it's not going to be you maybe, but it's what you do to others or what others do to you. So this is a two-way street. And healthcare providers out there are working very, very long hours. I thank them. Please, they need to also make sure that they're taking well cared for, and also caring for others as well is so important. It's, again, very, very important that we do care for each other.
Yeah, you know, I think as someone that just really does not like to be told what to do, and these ideas, you know, the whole, when the news first started coming down and all these restrictions were in place, you know, I was really skeptical and not wanting to comply. But then as time went on, you know, I was like, wow, this is really serious, you know. And I think there is a component out there that is, I think it takes a while for everybody to get on board with something like this. But you know, now that we're here, taking what we've learned and remembering it, hopefully, and bringing it forward, and you think we'll get through this, you know, in a reasonable fashion, and we're going to be okay. I mean, I think that's what I want to hear over and over again, because right
Absolutely.
now it seems like the end of the world sometimes. You know, this is weird.
It's different. That's all it
Different.
is. It's a little
Okay.
different for people, okay? And so, and you mentioned something early on. You work from home. This is no different for you.
Right.
Some people wanted to work from home, and it really starts to make people think: can we eliminate some of the things that we've been doing as rote things that we did day to day?
Exactly.
Do we need to be driving to work? Can we be doing things from home? And if so, when you're working from home, what are the disciplines that you need to do? You know, I go back to the ABCDEs of what I teach my patients. Once you're aware of something, hold yourself accountable in whatever you do. Always want to be best or better. So you have to develop some behaviors. You do have a choice now. Get committed to your choices. I know people are determined, but it's about being disciplined. This is a part that we're not accustomed to. Get educated about things, because it will empower you as you learn more and more. And yes, this is a work in progress. And at the end of the day, yes, we are all going to rest in peace. But in between it, let's live a happy life. And, you know,
Amen.
the senior population is growing in our community. So these numbers are more skewed, because we know that those are the people that would have been sick anyway if they got the flu. All right. And the testing of these people is, maybe we're doing more of it. More testing is going to be done. So hopefully we'll have a better understanding, and we will go back and retrospectively study this. And that's what the importance of preventative health is. And I have believed in it. I have been an advocate for it. And my patients, I love them all. Each one of my patients helped me to go out there, and they're out there educating our healthcare providers and their communities. Dr. Uma says, reach one, teach 10. Teach one, reach 10. And that's what we're doing here. It's a two-way street, folks. And I thank you all, and do your part.
Where can we find you? Where can people find you if they want to get a medical card at this point, or anything, any of your other services?
Absolutely. We are at Uplifting Health and Wellness.com. Contact us. Our phone number is 508-444-2324. We will be able to do a lot of the calls. We are trying to make sure whoever needs to be seen sooner than later, we are getting them in and getting the certifications in, but also to just answer your questions. Breathing exercises that I want to leave people with also.
Sure.
Make sure that you get a peak flow meter if you've got them, or those spirometers. Check those, use those as you're breathing so that you know where your breathing status is. For people that need to get into the hospital, don't wait if you don't need to. For emergent situations, I'm talking about emergent situations, make sure you know who to call if it does have to become an emergent situation. But our website, again, upliftinghealthandwellness.com, contact us. And we are going to be announcing that we are also doing personalized care, concierge medicine, and we're going to be expanding all of that. So we were going to be making all of these announcements, but we'll make it right here, right now with you. We are going to be providing VIP care for each one of our patients, and it will be affordable, and we'll get out more information to you.
Awesome. And I just, for anybody listening, thanks for tuning in. We will rebroadcast this, and it will be available for, future viewing. Again, thanks, Dr. Uma, so much. Do you have any parting thoughts?
Yes, we say namaste, and this is it's that I honor you, I love you, and I respect you. And I'm glad people are using this as a way, instead of having to touch people, but it is a nice way to show honor to other people, and don't feel like you don't have to, that you're not touching them, but you are honoring them.
Excellent.
God bless.
Namaste.
Namaste, G. Bye-bye.
Okay, take care. Bye-bye.